We are here at Shenandoah House, which is on the campus of Augusta Health, and this is a part of Hospice of the Shenandoah Care. And we are here with Lori Showalter and Mary Smith, and Lori is actually a volunteer coordinator here, and Mary, your mom spent time here last spring. I guess starting with you, Lori, if you could give us sort of a definition of what hospice care is.
Hospice care is medical care at the end of life. Focuses on compassionate quality of life versus quantity. And we have lots of trained nurses with end of life special training, palliative care training, and our focus is on comfort and quality more than quantity.
And tell us, how does the facility that we're in today fit into the overall hospice program? What do you do here at Shenandoah House?
Well, most of our patients are cared for in the home setting, and sometimes we get to the point where that's no longer possible. A caregiver can no longer handle the care that's needed. They don't have a caregiver. Some of our patients live alone and get to the point where they can't care for themselves any longer. And the Shenandoah House is our own assisted living facility where a patient can come when their days are limited and receive that quality around-the-clock care that can't be provided at home any longer.
And Mary, you can really speak firsthand to that. You lost your mom last May, and she was here at Shenandoah House, or part of the hospice treatment program, for several months. Tell us about your experience.
The experience that we had was an absolutely wonderful experience, considering the reason she was here. The care that she received was impeccable. And when we came here, I knew nothing about caring for anyone later in life like that. So that was one of the choices that we had to do. And I asked the doctor, and he said she would be a good candidate for coming. And so I said, great. So we came. And when Mom came here, the nurses were incredibly compassionate. They were caring, just like it was their own family member. They would come in and they would talk to her while we were there. I was there quite a bit of the day. I was there every day, and they would come in and talk to me as well as my sister and our whole family. They would tell us what steps would be coming next. And to us, which had no experience in that, it was really nice to know ahead of time. They were friends to us. Our whole family's here. We have a big family. My daughter would come in every day after work, and we would all sit and talk and hang out with Mom, and and it was like a home away from home.
So, what advice would you give after going through it? And Lori, you can certainly chime in as well with other patient experiences that you have. Is it time? Well, that all depends on what your physician has to say, on what the prognosis is that he gives you. At that point, you have to make decisions about what you're going to do, and I knew what my mom's wishes were. And so that's why we came here. And I just thought it was a wonderful place to come to spend her last days. I mean, we're here, and we could come in, which was a wonderful thing, any time of day we wanted, and we were welcome anytime we wanted. They made us feel incredibly welcome, no matter when we came, whether it was 8 o'clock in the morning or we left at 10 o'clock at night, 11:30 at night, and we could spend the night here if we wanted to, which we did. So it was just a really wonderful situation on what it could be. And Lori, you said very often, or in more cases than not, people do wait too long to inquire about or come into hospice care. That's what you find?
Absolutely. I think trying to accept the fact that you have a loved one that's not going to live much longer is hard for everybody to face. So I think a lot of people come into our services too late. Sometimes they wish doctors would have referred sooner, or they wish they would have come to an acceptance a little bit sooner so they could reap the benefits of everything we do have to offer.
And as we conclude, could you just spend a brief moment talking about money? I believe insurance pays for the medical care, but can you just elaborate, because I know that people will wonder, okay, how much does this cost?
Absolutely. With your regular hospice care, which again is mainly provided in the home setting, Medicare and Medicaid both pay 100% normally for hospice care. Most commercial insurances, there may be a copay or a co-insurance, but that is also taken care of through most insurance companies as well. And being part of Augusta Health, we can tap into the financial assistance program they have if we do have an individual who doesn't have insurance, and we do see that quite often as well. We don't deny services to someone because they don't have insurance. And then if a patient comes to the Shenandoah house, that's completely different. The hospice care is still covered, as I just mentioned, but the room and board at the Shenandoah house is a totally different fee, and that's private pay. So we do have to keep active fundraising and memorial contributions that come in. All that money, a lot of that money, I should say, goes to the Gifted Care program, which allows us to continue offering care in that type of setting for those that can't afford it.
My father was diagnosed with a rare bone marrow cancer. I didn't know what to expect when the doctor said, we'd like to recommend hospice, and I was amazed at the service that was provided. Hospice has improved the quality of his life. There's no measure for how much, and I didn't know that they would minister to me as much as they do to my father. It was the first time since my father was ill that I didn't feel alone.
Augusta Health, proudly serving our community as one of the nation's top 100 hospitals.